Magic mushrooms. Special K. What do you think about when you hear these words? Raves? Parties? Bad trips? Scary pink elephants in the corner of the room? What if I were to tell you that these were groundbreaking new medicines that were being studied to treat things like anxiety, depression, post-traumatic stress disorder, and even help people quit smoking? Today, I'm going to go over the ways in which these medicines are being used and studied to treat a wide variety of mental illness, mostly depression and anxiety, for people who have struggled to find a treatment that works for them. These are known as treatment-resistant people. First, we will look at what kind of medicines it is we're talking about, what they are, and then we will talk about who is doing this research and can we trust these people. And then we will look at the legality and the ways in which these medicines help people. So the CDC says that 1 in 3 people in the United States have experienced some form of anxiety. 1 in 10 people struggles with depression. So the first thing that we will talk about is these types of treatments. What are we talking about here? Well, the first one that we will talk about is ketamine, also known as Special K. So there are different types of treatment with ketamine. So you can get it in a prescription from a doctor for, you can get a nose spray, you can get a lozenge that you place in your mouth and it dissolves. And they also have clinics where you can go in and they do what's like known as an IV infusion. Shawminds.com, which is a website that helps people connect with doctors that prescribe this. And they also do like an online, so like you can do the treatment in your home, and then they have a video chat so you can talk to a doctor. They have professionals that are trained in these kinds of experiences and treatments to kind of walk you through the process. So Shawmind says the legality of this is it is legal in California through a licensed physician who must have special ketamine therapy training, right? And they also must have training and certification for controlled substances. So it's a specific kind of doctor, right? But it is legal in the state of California, and you can actually find it online. I did a brief Google search, and all kinds of different things came up. So with ketamine, it's mainly used for treatment-resistant depression, which is depression that might not be reacting or responding to traditional antidepressants. So traditional antidepressant would be something like Zoloft, Prozac, something that you've probably heard of before. We'll have more on that later. So the next most widely studied is psilocybin. Psilocybin is the active ingredient in magic mushrooms. And Johns Hopkins University, who is a world-renowned medical center and research facility, says our findings add to evidence that under carefully controlled conditions, this is a promising therapeutic approach that can lead to significant and durable treatment in depression. Now, with psilocybin, it is not currently legal on a federal level or through the FDA. There's one state that has passed a law to approve it in these kinds of treatments, and that's Oregon. So they're still fighting for this, which is something that California has in the works. So next, we'll talk about the type of research that has been done on these medicines and who's doing it. So like I mentioned earlier, one of the big names that you see in this research is Johns Hopkins University. So they, in 2019, opened a center known as the Center for Psychedelic and Consciousness Research. okay, that studies in medical clinical trials the effects of different kinds of psychedelic medications, ketamine, MDMA, psilocybin, things like that, on mental illness, different types of mental illness. Now, the National Institute of Mental Health says about ketamine that it shows significant improvement, the patient shows significant improvement in depression, anxiety, and severity after 2 weeks and 1 month of treatment. Now, in case you didn't know, traditional antidepressants typically take at least 4 to 6 weeks for you to even start feeling any kind of difference. So for anxiety treatment, there are a wide variety of places that'll help you. So one of them is Mind Bloom. That's a company and again a website that connects you with doctors, and they walk you through a whole process. You do it in the comfort of your home. So Mind Bloom says about their ketamine treatment that people do at home, 89% of clients reported improvement in depression and anxiety symptoms after only 4 doses. That is a very significant amount. Now, how much of that is a placebo effect, we don't know yet. So current treatments for anxiety include, traditional treatments, include things like Xanax, benzodiazepines, which are highly addictive medicines. They build up in your system, and if you suddenly stop taking them or run out unexpectedly, you will go into withdrawal symptoms, and it can actually be like a very significant medical crisis event at that point. They also have side effects that include, sleepiness, going through withdrawals, which can cause seizures, things that are very difficult and traumatic for people. So results from clinical trials show that things like ketamine and psilocybin alter your brain chemistry, and they make it so that you can form new neural pathways. So lastly, I will be discussing how they have helped and why they should be legalized. So the National Institute of Health says that 17 million people in the United States and 300 million people in the world have suffered from depression. That is a very significant number. A Johns Hopkins study done recently shows that on psilocybin, the effect of psilocybin, that the magnitude of the effect we saw was 4 times larger than traditional antidepressants. So there is a variety of alternative treatments out there. Today we have learned about the reputable scientific studies on treatment with ketamine and psilocybin. We have heard statistics and documented results of these medicines from reputable medical research facilities and reputable companies that provide these treatments. We have shown that they are much more effective for people with treatment-resistant illnesses like depression and anxiety than what is currently on the market. And we have examined the legality of these medicines. In conclusion, psychedelic treatments show great promise for many people with mental illness, and they should be legalized.